Welcome back. COVID-19 cases are making a concerning comeback across many countries worldwide. And on Viewpoint today, we assess the current situation in efforts to contain it here on the local front. For more, I have Professor Jung from Hallym University, who is also the head of the National Infectious Diseases Consulting Committee. It's good to have you here, Professor Jung.
Thank you for having me.
I also have Professor Sohn at Seoul National University live on the line. Professor Sohn, as always, it's a pleasure.
Good to be back, Sunny. Thanks for inviting me.
Right, Professor Chung, we'll start here then. The start of a new wave has been confirmed by local authorities, and they say it has reportedly arrived earlier than expected. What do you suppose has prompted this early rebound?
Well, there are several factors in there because the first factor is the decreased alertness. People didn't pay much attention to COVID-19, and people hang around and meeting people freely. It was very good for the last 2 months, as people were very less alert. But the second thing is because of a BA.5. It's a subvariant of Omicron, but it acts quite differently. It has a different antigenicity, and it evades all the immunity people have made in their own body, either by infection or a vaccine. And the third one, the immunity wanes, because many people got a third shot and waiting for a fourth shot. But after 4 months of a third shot, we need a fourth shot. During that time, the immunity wanes and people get infected easily. And even the people who got infected with Omicron, they are having a decreased immunity, decreased level of antibody these days. That's another factor of current infection.
Right, I see. And against that backdrop, Professor Sohn, what do the current tallies on critical cases and fatality rates tell you about the severity of this latest surge here in the country?
Yeah, no, thanks for this question. So we know for sure, I think, from other countries as well, that compared to the earlier waves, the hospitalization, death rates, all remain below the previous peak. So, and then we're anticipating, as we anticipate another potential wave due to BA.5 and BA.2.75, we also can ascertain the severity of the situation that we could face here in Korea from other countries' experiences. But all these other countries have shown that the severity definitely has come down a bit compared to the earlier variants. And like Professor Jung has said, in Korea we've vaccinated a lot of people, and we've done really well in terms of protecting our most risk populations. So that we have good number of people who are immune protected. Of course, the new variants have a tendency to escape these immune systems, but we can anticipate from studies as well that the people with intact immune systems who are healthy and those who are vaccinated, and also we've had a lot of people been previously exposed to COVID during the first Omicron wave, we can expect that these people will have less severe disease if there's a subsequent infection. But we have to be really watchful and be careful about the high transmissibility that the new variants carry and how these evolve. So I think we can't really let the guard down because of the fact that the severity of the disease has waned a little bit down.
Right, and perhaps as part of such prevention efforts then, Professor Jung, the recommendation for second boosters has been expanded to all those in their 50s and above, and all those who are 18 and above with underlying health conditions. Could you tell us a bit more about this decision?
The first indication was 60 and above, and with all with the underlying diseases, who has organ failure or immune compromised states and etc. And government yesterday announced that it will expand the age range from 60 to 50. So about 8 million people who are in their age of 50s need to have a fourth shot or a second booster. Because in the 50s, the study says that the mortality is 10 times higher if you are not vaccinated. That means no vaccination at all in those people. But once you have a 1 or 2 or 3rd or 4th shot, then the mortality rate decreased by 10%. So 1 in 10 decrease of mortality. So still, and the 50s have a higher portion among all deaths in Korea. So that's why the government included the 50s in their indication. And the second booster, people are talking about the second booster is not very effective in Omicron, particularly in BA.5. That's true. It only prevents infection by 20%. It's not a big deal. But as far as mortality is concerned, it decreases 50%. So why don't you have a second booster if you are in a very high risk group? So I strongly recommend all indicated people to get a 4th shot or a second booster.
Right, I see. Professor Sohn, as you mentioned, the World Health Organization has also spoken about the finding of a new variant, the BA.2.75 over in India. What can you tell us about this particular strain and how worried should we be?
So on the last part, worried part, I think we should always be concerned and be watchful and worried about new variants. I don't think we should be afraid of these new variants because we know that these viruses, this is a natural tendency that they are bound to survive through various challenges through evolution. So we should be worried, be watchful, but shouldn't be afraid of facing this new variant. But just to say that BA.2.75 I found in India, and it does have potential to cause a wave like BA.5. There's going to be a mix of those. It's been found in other countries like Australia, New Zealand, the UK, and Germany. It's likely to be found in elsewhere as the global community moves with the lesser restrictions. One of the things that concerns about this variant is that it carries 8 additional mutations on the spike protein, and particularly the concerning mutation is on the G446S. This is particularly the site that's potent for antibody escape. Researchers, though, have found that people who've been previously exposed to BA.1 variant is likely be protected. But then we should also be watchful of co-infection of people with 2 variants, BA.4 and 5 and BA.2.75, as these are co-circulating in these countries that could potentially rise to a new type of recombinant variant that could be much more harmful. But again, I think we have tools, we have information, the general trend is favorable, so that we should be worried, but again, not be fearful about this.
Right, I see. And along with co-infection, Professor Jung, reinfection remains a challenge in quite a number of countries. And that being said, what can you tell us about the rate of reinfection here in South Korea?
The rate is increasing. It's around 3%. 1 month ago, it's around 2.some%. The reason why we were having a reinfection increasing is just because of a BA.5 or decreasing immunity, as I said before, including decreased alertness and etc. So we definitely need a new kind of a vaccine, so which is called a bivalent vaccine. It contains first virus, which is a Wuhan variant, Wuhan virus plus BA.5, or U.S. will be including a BA.4 plus. So until we get a new kind of a vaccine, it is inevitable to get a reinfection. So I would recommend everybody to get a 4th shot and to be more alert than before we have a new kind of a vaccine. Maybe as early as early October, or maybe by the end of this year, we're going to have a new vaccine to prevent the BA.5.
I see. Professor Jung, is it true that there are people here in the country who have been infected with COVID-19 3 times?
Well, yes. The number is around 100. It's a very trivial number. But because of those people exist 3 times or even 4 times later, so we need another kind of a prevention. That is a new kind of antibody. So it's called, this brand name is EvoShield. The government is going to import that one maybe next month. And that kind of antibody, even though it's an antibody, you have an injection, And previous in advance injection can prevent the infection. So the antibody in your body lasts for about 6 months. And during that time, if you get infected, you can defeat the virus. Those people are very limited. People who cannot make any antibody with repetitive vaccination, and who are very weak, and who have a very serious adverse event with the previous vaccination. So maybe those people will get a very high benefit from those kind of very specific antibody treatment, even though it is very expensive.
Right, I see. Meanwhile, Professor Sohn, speaking within your capacity as a health expert yourself, what are your thoughts on the readoption of COVID-19 prevention measures to curb community transmissions?
Yeah, so I think we should first define what do we exactly mean by prevention measures. If it's a non-pharmaceutical intervention such as social distancing, I think there's going to be a lot of challenges, right? It's going to be extremely difficult, especially implementing much more stronger intervention measures after having relaxed this. People usually behave after relaxation of much stringent restrictions, people have tendency to refute that. So, and also considering the nature of the virus that we're seeing right now and how it's fast spreading, we tried a lot to prevent through very active social distancing measures and whatnot to prevent the waves for Omicron. But we've seen countries like us, Taiwan, New Zealand, all have experienced the Omicron wave. So I think it's going to be very difficult in two ways. One is because we have already relaxed it, and then to re-implement it is going to be difficult logistically. And then to see the same or similar type of effect from the earlier period of the pandemic through the same social distancing measure, we're likely going to have to close the doors and everything. But we've also seen China that's doing that, but that's really realistically difficult. On those two fronts, I think social distancing measures, reintroducing stronger measures is going to be very challenging and may not be so idealistic at this time. What we should remind ourselves is that compared to earlier part of the pandemic, we are fighting very difficult virus. The virus is evolving, but we also are gaining information very fast about these variants, and we are finding solutions. We also have a lot of different tools, treatments, and also we have to encourage and be encouraged that our Korean people, we've been wearing masks, and we've been very adherent to wearing masks and protecting ourselves and others. Even after masking guidelines were relaxed. So I think there are a lot of other ways that we can protect ourselves and be protective of oneself and of one another. So I don't think there's a need or necessity to readopt much stronger social distancing measure as one of the preventive measures. We have other tools to cope with this anticipated wave.
Right. Professor Jung, as Professor Sohn has said, the people here in the country, the public, they've been very good with wearing their face masks indoors, of course, and also some of them outdoors, quite a number of them. That being said, what more perhaps can be done to further perhaps boost public vigilance against the pandemic as we continue to fight?
Yeah, people have been very compliant to government policy like wearing masks. Even that they ease the outdoor masks, 70% of people are wearing masks outdoors. This is very, very nice people. But there is a saying that it's not over until it's over. And the director of WHO said that no one is safe until everyone is safe. So we have to keep our vigilance until maybe next spring. Because the reason why I say the next spring is if we overcome this winter and probably a big surge, then we can be establishing a treatment system, and we'll get a more effective vaccine. And so by that time, we can be free without any mask indoors. But until that time, the mortality is very high, 2 times higher than influenza. the morbidity is not less than influenza. It's very sorry. I myself suffered COVID-19, and because of swelling of throat, I had to wake up during night. It's a very big agony. It was big agony, and it is still very highly contagious. The reproduction number is the highest ever. People say that measles is the highest one. The RO reproduction number is around 15, but some studies say that BA5 the RO is 18. So the highest ever, which have intimidated mankind. So very high contagiousness and very high mortality, still very agony morbidity. We have to be very, very careful. So until that time, we have to be very, very careful, but keep our vigilance on COVID-19.
Right. And against this heightened sense of danger then, Professor Sohn, on the vaccination front, do you suppose we should be expanding our coverage to include toddlers, as is the case over in the US?
Yeah, so I think we are talking about a lot of different interventions, and this is one, expanding coverage and protecting those who could be immune compromised. The toddlers are definitely one of them. In the U.S., they've been actively recommending. So what I'm saying is that we've had with the adults and during the social distancing period, that we mandated the vaccine to access public spaces and whatnot. I don't think we should be mandating the vaccine, but recommending with good supportive evidence that we should have Korean-specific evidence on vaccinating children and toddlers. I think the 5-year-old onwards, we are recommending already, and there are specific vaccines that are available now that's a lower dosage specifically catered to younger adults. But for toddlers, I think we also should be vaccinating them, but again, not mandating, but recommending strongly because they are, in some ways, immune compromised. So we have duty to protect them. One thing that concerns me a little bit is that there's already a lot of vaccine hesitancy. People are getting tired of second dosage, third dosage, fourth dosage, and so on. But if you think the context a little bit differently, and we are anticipating the pandemic to become an endemic, right? There's no such thing as now that we will eradicate this disease, but we are coping with the disease. And we know the flu changes yearly, and we have to get flu vaccines. We are not mandating, but for the sake of protecting one another as well as ourselves. I think we should have a different strategy to encourage vaccination rates to make sure that people are protected in differential ways, than just trying to say this is the right thing, this is the other thing to do. So that's kind of one thing I think we should be approaching. We should differentially strategize for the longer term perspective of the COVID-19 situation.
Right, of course. Professor Jung, I am aware that health authorities here are collecting data on long COVID. What has been the progress on that front? And do you suffer from long COVID?
No.
Fortunately, that's good to know.
I suffered a lot during a COVID period, but after that, I do not feel any kind of long COVID symptoms. I'm lucky. I called this morning to NIH, KNIH, National Institute of Health. What's the progress of long COVID study? Unfortunately, they have a budget, but they didn't start it yet. They are recruiting a study group. So there are many hospitals, academic societies, and even the local clinics could be participating in the study. But luckily, Korean Health Insurance Authority has made a disease code, so which means the code is for a long COVID, and which means that we can have extensive data on that. Because any doctor can put a code of long COVID in their patient's record. And if you collect the long COVID code all over up and down the country, then you can collect various spectrum of long COVID one. As you know, the long COVID has brain symptoms like lightheadedness, foggy headedness, even the psychiatric symptoms, and cough and dyspnea, and it's even the hair loss, and the lots of expensive spectrum of diseases. So not only the internist, but also a neurologist, even another kind of specialist could be participating in that, including GPs in the country. So we'll see, and how many people are suffering from a long COVID from now on.
Right, so it's a very extensive undertaking then. All right, Professor Jung, who is currently the head of the National Infectious Diseases Consulting Committee, thank you so much for your time today. And Professor Sohn at Seoul National University, thank you very much for your insights.
Thank you.